Hello, everyone. My name is Siddharth Mummaneni, and today I will be presenting on Breaking the Cycle, Challenging Global Inequities in Mental Health. Before we get into the presentation, I'd like to share a little bit about myself. I'm a rising junior from Lake Orion, Michigan, where I've started our school's first ever hosted chapter, along with a science exploration club, Dragons Explore. I'm an executive member of Cultural Outreach, where we work to promote diversity, equity, and inclusion. I work towards educating others about different cultures, religions, and ethnicities while breaking stigmas that are associated with them. I'm also actively involved in Sources of Strength as an executive board member. SOS is a mental health club that focuses on upstream prevention of mental health illness and fosters support systems within our community. My work in both of these clubs was really where I gained exposure to the importance of mental health and the multifaceted aspects of it. My future plans are to go into neuroscience and neurosurgery. To begin, mental health is a fundamental component of overall well being, encompassing an individual's ability to realize their potential, cope with life's normal stressors, work productively, manage emotions, make sound decisions, and contribute to their communities. And mental illness is the inability to do those things. To really emphasize the prevalence of mental illness, the WHO says that 1 in 4 people worldwide will experience a mental health disorder in their lifetime, while 1 in 8 people are currently affected by a mental disorder. Those numbers are not completely accurate, however, with developing nations often facing substantial underrepresentation in these global statistics. This is due to challenges such as insufficient infrastructure, limited understanding, and prevailing stigmas surrounding mental health. To address these disparities, we turn to this idea of global equity. Global equity refers to a fair distribution of resources and opportunities for all individuals worldwide. Through my involvement with Sources of Strength, cultural outreach, and extensive research, I've developed a model that illustrates how mental health disparities perpetuate a hidden cycle of inequity. For those living in poverty and in marginalized areas, mental illness is an unfortunate effect. Living in these conditions can contribute to chronic stress, adverse life events, and a lack of access to mental health support. These factors increase the risk of developing mental health disorders such as depression, anxiety, and PTSD. In turn, mental health challenges hinder economic and social thriving, affecting stable employment, education, and healthy relationships, thus perpetuating the cycle of poverty and marginalization. From there, people often face reduced opportunities and support. Limited access to appropriate treatment services and support systems hinder one's ability to overcome these issues and improve their socioeconomic circumstance. Finally, stigma and discrimination comes from negative societal attitudes and misconceptions that are reinforcing social exclusion and barriers to seeking help, making it harder for people to escape this cycle. This perpetuating cycle is not limited to mental health. The effects of this cycle are seen on a global scale and have impacts to other areas, putting a burden on global healthcare and economies. These disorders can contribute to the onset or worsening of physical health conditions, affecting life expectancy and overall well being. Some examples of this being a 64% chance that coronary artery disease is increased, a 37 increased risk of developing type 2 diabetes, and to put it into an economic standpoint, $201 billion are spent in comorbid healthcare costs every year, and $1 trillion are lost in economic output per year. To alleviate the additional burdens caused by global health inequity, it's crucial to break this cycle. The WHO's Mental Health Action Plan plays a significant role in addressing these issues on a global scale. Moreover, several community-based approaches have demonstrated promising results in destigmatizing mental health and enhancing access to treatment services. Collaboration amongst governments, healthcare systems, and international organizations is vital for addressing mental health and global equity. Integrated and culturally sensitive approaches are crucial to ensure inclusive care for individuals from diverse backgrounds. It's important to highlight the effectiveness of these efforts Because research studies have consistently shown that for every dollar invested in mental health, there's a return of $4 in improved productivity and reduced healthcare costs. This outcome significantly contributes to lowering the burden associated with mental health. Over the past 3 years of high school, I have focused my efforts in breaking this vicious cycle in my community. With my work in cultural outreach, I've focused on making a difference with respect to poverty, stigma, and marginalization. I have raised $500 for poverty relief organizations like women's shelters and food pantries. I've hosted 15 homeroom activities and community-wide events to break stigmas and educate on various cultural histories to over 2,000 students. My efforts and sources of strength include a campaign for increased availability of social workers, 20 plus events educating 2,450 students on upstream support networks and strategies, Miracle Minute drives to donate to mental health foundations. All of these efforts combine to combat mental illness and its effects while enhancing opportunities and support. The really important thing is that every single person can be doing something like this to break the cycle in their own communities. Building resilience and support networks is what we do in Sources of Strength. While in cultural outreach, we work on breaking stigmas and promoting awareness. Additionally, we can increase access to mental health services, bridging the gap between communities and resources. We can also provide education and skills training. Finally, we can advocate for policy changes to address systemic issues. My last thought to everyone here is this. To further advance mental health globally, increased investment in mental health services is crucial. So it's imperative that we lead this change by utilizing resources that are readily available to us, like volunteering opportunities and technology. This allows us to invest in the breaking of cycles in our own communities, in the pursuit of breaking the global cycle of mental illness. Here are the references for some of the statistics I used. And I'd like to thank Sources of Strength, along with everyone at Cultural Outreach, for opening my eyes to this issue and giving me a place to make a difference. Thank you to Global Health Leadership Conference at JHU for this opportunity to share my passion for an important cause. And thank you to my family, friends, and teachers for guiding me and being my biggest supporters. Thank you everyone for listening, and feel free to contact me with any questions or feedback.